session identifying patients with high complexity who are missing cycles of care using Primary Sense. My name is Harry Howell and I'm the Senior Product Officer here for Primary Sense at Gold Coast Primary Health Network. Before we start, I'd like to acknowledge the traditional custodians on the land upon we meet virtually today and pay my respects to elders past, present and emerging. And just some housekeeping before we do start. Today's session is being recorded and there will be a session at the end where you can ask any questions. In the Primary Sense tool, there is the Adjusted Clinical Groups ACG Johns Hopkins tool. So you may ask, what is this? It is a third-party application for Primary Sense that analyzes the data extracted by Primary Sense from the practice database. The Johns Hopkins tool is underpinned by robust evidence based on more than 30 years of practical application and has been used in 20 different countries and validated in different healthcare settings, including general practice. The ACG tool updates patients with complexity levels in Primary Sense automatically. It stratifies the patients, identifies patients who are most likely to have poor health outcomes or benefit from assessments and other medical care. Stratification supports planned coordinated care for patients and also prioritizes patients and reassures practice staff that no one is slipping through the gaps at the practice. You may ask, how is the ACG complexity score calculated for patients in my practice? First, data is imported into the ACG tool automatically by Primary Sense when either a practice first onboards or when there is a subsequent visit by that patient. The ACG tool takes the following from Primary Sense: the patient's demographics, diagnosis recorded in the past 12 months or any long-term conditions, current medications prescribed to the patients, pathology, and MBS and PBS cost for this patient. From the above outputs, the Johns Hopkins ACG tool runs an algorithm over the data to create a complexity score for each patient in the practice. The scores do vary. A level 1 score indicates a very low level of complexity with no identified risk for poor health outcomes, while level 5 is the highest complexity in the ACG tool. Patients level 5 complexity typically have significant multi-morbidities and are at greatest risk of poor health outcomes. This slide here shows you the different levels of complexity in Primary Sense. As I was saying previously, level 5 here is for the most complex patients in your practice, whereas level 1 is low complexity patients. You also see in the Primary Sense tool, there can be level 0 for patients. This would indicate the patients have no recorded diagnosis or significantly incomplete or missing data. We of course don't expect you to remember all of these levels here. So when you are using the Primary Sense tool, in any single Primary Sense report you view, there is this option here which says what are the ACG patient complexity levels. If you click on this aqua box here, this field here will expand down. It will detail what each level is and will also show you how this is calculated for patients in the practice. There are numerous reports in Primary Sense which you can run at the practice, which show you the complexity of your patients. One of the first reports you can run at the practice is patients with high complexity 5 and 4. And this report shows patients with the highest risk of morbidity and mortality. So this is patients with a complexity score of 5 or 4. It'll also show you of these patients who may be eligible for chronic disease care, including a new or review of a general practitioner management plan, or also a team care arrangements and or provision of practice nurse services. When the practice report is run for patients of high complexity 5 and 4, to qualify to appear in this report, these patients have attended the practice at least once in the previous 12 months or been prescribed a medication within 12 months of the date of this report. This report also presents the number of medications these patients are currently on as accounts in the past 12 months and before that. It may also prompt for a review of the medication list for accuracy and/or polypharmacy issues. At the end of today's session, I will show you a demo of this report and show you how you can use this in theory. And if you are to click on the Primary Sense desktop app and click on Reports in your practice, this screen here will appear, as you know, which details all the Primary Sense reports that you can open. If you double click on patients with high complexity, 5 and 4, that will show you the report we have been talking about. And here is the output for that report in Primary Sense. So you can see the first column, which you can remove patients, which I'll show you in the demo, the patient name, their phone number, their last visit, existing appointment, GP name, clinic, age, indigenous status. Here we have hospital risk. That's their hospital risk in the next 12 months. Once again, that is calculated by the ACG Johns Hopkins tool, and any score that is above 80% will appear in this report. So looking at this demo data here, for patient D. White, they have a 99% hospital risk of entering a hospital in the next 12 months. We then have current medication started in the past 12 months. Current medication started more than 12 months ago. And here we have last medication review, GPMP review, team care arrangement, TCA review, practice nurse number 10997, and practice nurse number 10987 for Aboriginal and Torres Strait Islander patients. It'll also show you for these two practice nurse numbers how many have been claimed in the calendar year. So you can see here for patient B. Jones that 0 have been claimed in this calendar year. Where the field is unpopulated or blank, that means it is unapplicable for that patient, or where it says due, that means it's currently due for that patient. So looking at D. White, I could see that D. White is due for a general practitioner management plan, and as D. White also identifies as Aboriginal or Torres Strait Islander, indicated by the yes here, I can also see that D. White is eligible for the Aboriginal and Torres Strait Islander practice nurse number. You can see here as an example for this patient here, C. Taylor, if we go from left to right, we can see C. Taylor's doctor is Dr. C. Lee. They are 76 years old. They've been prescribed no medications in the past, or started no new medications in the past 12 months, but current medications started more than 12 months ago equals 15. We can see for C. White, they are not due for a GPMP, so that would indicate that C. White has received this MBS item of care in the last 12 months, but we can see that C. White is now due for a review of that GPMP. The second report that you can run in Primary Sense is by clicking on Reports, and this time clicking on Patients with Moderate Complexity, Band 3. So what this report will show you is identical to the previous report we're just looking at, but this is for patients with a complexity score of 3. It's also important to note many Primary Sense reports include the ACG score. By default, Primary Sense will sort patients with the higher complexity to appear first in the report. And this may be in the practice, you could prioritize patients with a higher complexity first. So here's an example in Primary Sense. I did run the health assessments for patients aged 75 years and over. So I wanted to see who was currently eligible or due to receive a health assessment in my practice who is aged 75 years and over. And here you can see the patient's name, etc. But you'll see here in the second column, it does include the ACG score for these patients. So I can see that W. Johnson, who's currently 76 years old, is due for a health assessment, and their complexity score is 5 out of 5. So I can prioritize these top patients first with the higher complexity scores to follow up if they wish to receive a health assessment. It's also important to note when a document or report is opened in Primary Sense, a folder is automatically created on the computer in use. So if you do open a Primary Sense report on your workstation, please click on File Explorer and open Documents. Once you open Documents on your computer, you'll see a Primary Sense folder has been created, just like this. If you double click on that Primary Sense folder, you'll see two new subfolders, Quality Improvement and Reports. If you double click on Reports, that will show you any report you have previously ever downloaded in Primary Sense. And here we are here. So here is a Primary Sense desktop app. Today, I wish to view the patients in my practice with a complexity score of 5 or 4. So these are my most at-risk patients for mortality and morbidity. If I click on Reports, this screen here will appear. And these are all the reports that I can open in Primary Sense. If I double click on patients with high complexity, 5 and 4, this shows me the report is currently downloading, and here it is now. This is showing me in my practice which patients have a score of 5 or 4 from the ACG Johns Hopkins tool. If I click on this, which patients are included in this report, it will show me patients with a complexity score of 5 or 4. These patients may be eligible for chronic disease or mental health care, including new or review of a general practitioner management plan, team care arrangement. And these patients have had at least one recorded consultation or been prescribed medication within 12 months of the date of this report. And once again, we can click on what are the ACG patient complexity levels, which will detail each level for us. So level 5, level 4, etc. As we scroll down, we'll see the first table shows patients with a complexity score of 5. So if we scroll up, we know patients with complexity score of 5 have higher complexity, characterized by instability, multimorbidity, polypharmacy, or patients requiring end-of-life care. And if we scroll down, the next table shows us patients with a complexity score of 4. So these patients are still complex patients, not as high as the 5s, but are still very complex patients. And if we scroll up again, we can see what level 4 is, high to moderate complexity, characterized by multi-morbidity. So once again, going back to the PowerPoint which we previously talked about, you may ask, how is the ACG scores here being calculated? The ACG Johns Hopkins tool reviews data from Primary Sense for patient demographics, diagnosed, recorded in the past 12 months, or long-term conditions, current medications, pathology, and PBS, MBS cost for this patient. From those data, it then runs an algorithm and generates a complexity score for every patient in your practice who has visited a practice at least once in the last 12 months or been prescribed a medication in the last 12 months. If we go down here for patients with a complexity score of 4, if we scroll down, you can see that in my dummy data today, I have 51 patients in my practice with a score of 4. I can filter through these tables if I wish, just like this, to show all patients. But a little trick I like to do is scroll to the top. By default, Primary Sense will show 25 patients per page. I will click this and say, show me all patients on this page. And now you will see on this one page, all 51 patients. What I can do now is also sort through these lists. So I can say, of my patients with a complexity score of 4, show me who's currently due for a GPMP review. By clicking this, it'll bring all those patients to the top. Currently in my dummy data, no patients are due for a review. If I want to know in my practice who is due currently for a team care arrangement review, I would click on TCA review and once more, and it will show me all the patients who are currently due for a team care arrangement. Now, once again, this is searching at your practice, best practice, or medical director. An example here is G. White. If we did contact G. White to see if G. White wished to receive a team care arrangement, and the answer was no, I received that at another practice, you could simply go across to G. White and click remove. We can now see that this patient contact has been successfully updated and removed. So when you run this report again, G. White will not appear. You can also export any of these lists to Excel by simply clicking on Export to Excel. You can see it's downloaded here, and it's told me Primary Sense download has started. It's now finished. I'll double click on that Excel document. And here is the exact same table, but now it's in an Excel format. So if you wish at your practice, you could tailor this report to really meet your needs. So you may want to look at all the patients in your practice with a complexity score of 5 and 4, and you want to make sure that all the patients aged between 80 and 85 are up to date with their GP management plans. To do that, you would simply click on column 2, click on data, click on filter, click on age. I don't want to include all ages. All I want to do is include patients who are aged between 80 and 85. So I'll select 80 to 85 only. And all I want to know is of my patients aged 80 to 85 with a complexity score of 4 or 5, who is due for a GPMP. And as you can see here, all the patients in my practice in this age cohort are due for a GPMP. So I can follow up with them through a phone call or also see when they're booked in to visit the practice. Column D here, existing appointment, will show you the date, the patient, if they are booked in, to visit the practice again. And likewise, column D is here, existing appointment. So this column here will show you what date the patient is booked in to visit the practice. With other reports you do run in Primary Sense, as I was previously alluding to as well, if I was looking at in my practice who is due for a health assessment, I would run this report, double click. As you can see here, it's currently downloading, which will open in your default browser. This report here will show you patients aged between 40 to 49, Aboriginal and Torres Strait Islander patients, and patients aged 75 years and over. When you do run this list, you may look at patients aged 75 years and over. So if we scroll down, here it is here, health assessments due for patients who are 75 years and over. If I scroll to the bottom, I can see in my practice, there's 343 patients who are currently due for a health assessment. You could prioritize this piece of work by looking at the ACG score here. As you can see here in the second column, the patients with an ACG score of 5 appear first, followed by those with a score of 4. So by default, Primary Sense sorts the patients with the higher ACG score to appear first. And that could be a way to approach these patients. Once again, if you scroll to the top, if you're ever confused on what the ACG patient complexity levels are, if you click on this, it'll detail each level for you and how they're calculated.